This does appear to be linked to travel. The patient was contacted as per usual as soon as the positive result was arrived at surveillance, and public health investigations immediately commenced, as well as contact investigations. We've updated our web page to list dates, flights, and affected seats where people may have been exposed to someone who later tested positive for COVID-19. This information will be updated regularly as we continue our public health investigations. To date, more than 3,300 tests have been done for COVID-19 in Manitoba at Caledon Provincial Lab. At this time, the public health orders that were announced yesterday apply to public places. They do not apply to workplaces. There was some confusion arose to that yesterday. However, the time for social distancing throughout Manitoba was last week. And so we are encouraging everyone to know their roles, their parts that they can play to improve social distancing measures. So although those orders do not right now apply to workplaces, we are strongly advising workplaces to take these considerations now seriously and to look at ways to improve social distancing strategies within their workplaces. It is vitally important that all returning international travelers self-isolate and self-monitor for symptoms for 14 days after return to Canada. Again, the vast majority of cases in Canada, almost all cases to date in Manitoba, are related to international travel. And so this is a vital social distancing strategy to ensure that all returning travelers self-isolate for that 14 days after their return to Canada. It's important to note that not everyone needs to be tested for COVID-19. All international travelers with symptoms of respiratory symptoms should call Health Links to be assessed for the need for testing. People who have been advised that they are close contacts to COVID-19 confirmed cases, they should be self-isolating, and if they develop symptoms, they can contact Health Links for the assessment to be tested. We want to ensure that we're testing appropriately. We continue with our social distancing messaging. We've heightened that with our public health orders that were announced yesterday. Again, now is the time for Manitobans to continue their preparations, to go to our website, keep up to date with credible information, and now is the time to act. It's not business as usual. Now is the time for social distancing strategies. This shows us that we are definitely not helpless against this virus. We're seeing Manitobans across our province stepping up and taking actions that are really going to limit the impact of this virus on our province. And so social distancing really at this point means staying home as much as possible if you can. Limiting your contact, close prolonged contact with others at 2 meters and greater than 10 minutes. Other social distancing strategies such as avoiding these large groups. And these are vitally important to those at increased risk of COVID-19 complications, those over age 65, those with underlying medical conditions, and those with immune compromise, in addition to the people who are around them. We don't want to be bringing this virus to our loved ones who are at increased risk. So again, our strategy is for all Manitobans to understand their role and the part that they can take. We can protect ourselves. We talk about frequent hand washing, limit our travel, limit going to large places. Second, we protect our loved ones, the people around us, and that is covering your cough and sneeze, again, avoiding large crowds, disinfecting surfaces regularly, and then just as important, protecting our community. Practice good social distancing. Stay home if you're sick. Stay home if you can. Cancel events and use those reliable sources for information. And this way we can protect ourselves, the people around us, and our communities from the impact of this virus. So we are certainly not helpless. We certainly have actions in place right now to limit the impact of this virus. And going forward, if we work together, we can, as Manitobans, overcome this pandemic. So thank you. I'm going to pass it to Lynette.
Thank you. Good morning, everyone. I wanted to begin today by talking about the students at King George School in Brandon. Earlier this week, the grades 7 and 8 students involved in the school's Youth Revolution group were asked what they'd like to work on this week, and they decided to show their appreciation to healthcare workers. The class made cards thanking healthcare workers for their efforts as they continue to respond to COVID-19. It's a small gesture from the public, but it's these kind of gestures that help inspire frontline staff working long hours to keep going. We know art also can be an excellent way for kids to pass the time at home while classes are suspended. It's also a great way to send love and support to the healthcare workers who are doing all they can to help Manitobans get through this pandemic. So thank you very much to the students at King George School and to their counselor, Robin, for the heartwarming gesture. We love it. An update on the health system changes that are happening. So yesterday at HealthLinks, we received more than 2,200 calls, and the average wait time for those calls was 49 minutes. So that's a big improvement from a couple of days ago when the wait was over 2 hours. We also have now introduced the interactive voice response that Digital Health has been working on for the past several days, so it's now up and running. So I will just let you know that this interactive voice response is not a direct link to HealthLinks. It is similar to the online screening tool that's available on the web. So for people who do not have internet access or people who prefer phones over the web, it's the same thing. It'll walk you through some questions and help you determine what the next steps are. The online assessment tool has received almost 20,000 hits on the web yesterday, and we're up to more than 206,000 views since its launch. The French version of this online tool has received more than 500 views since launching last Thursday. For the community area testing sites, approximately 3,400 people have visited these community testing sites across the province, including 403 yesterday. 54 people visited the new drive-through location in Steinbach, and Winnipeg's first drive-through location has opened this morning at 9 o'clock at the MPI Bison Drive Service Center at 19 Barnes Street in Fort Garry. And we would like to thank MPI for letting us use their space and moving as quickly as possible to allow us to get things running. So they are open at the Bison location 9 a.m. to 6 p.m. 7 days a week. And this is the 11th community testing site we've opened in the past 10 days. As a reminder, these are not walk-in clinics. People need to receive a referral to these sites. Manitobans are asked to call HealthLinks to receive instructions as to whether they need to be tested. And remember, only Manitobans with respiratory symptoms and international travel in the past 14 days need to be tested at this point. All other Manitobans are asked to stay home if they are ill. So just to wrap up before we open to questions, I do want to thank the public for their support and patience over this past week and a half. A lot of change has happened in our lives in a very short period of time, and we really appreciate everybody's commitment to practicing social distance and doing their best to limit exposure to the virus. So to the public and the providers, thank you. We appreciate everything that you're doing, and we will get through this together. Thank you.
Questions?
Yeah.
You talked about the private businesses. For the folks who are working in private business, what can they do if their employer isn't following guidelines? Is there anything enforcement on your side, or are there things or steps that those employees can do to protect themselves? We've had reports of a few reports of people who are in those types of situations with offices up to like 100 people in them at a time. What can they do to protect themselves?
So the public health order that was issued yesterday doesn't yet apply to workplaces, but again, the time for implementing social distancing strategies for all Manitobans, including employers, was a week ago when we started announcing this. And so I encourage employers to act now, to look at ways to improve social distancing, widening space between employees. If employees can work from home, try to do so, access to frequent hand washing, disinfecting of surfaces, ensuring sick employees stay home when they're ill and make it easy for them to stay home when they're ill, make it easy for employees who need to self-isolate to stay home to self-isolate. So these are all things that should have been in place now. I'd encourage employers to continue working towards that.
Right, but if the employers aren't taking those social distancing steps, what can the employees do to protect themselves, or are there people that they can talk to regarding that? What should they do in that situation?
Well, right now, certainly the public health orders aren't applying. So other than us meeting with employers, sending out our message to them, they would have to speak to their own occupational health and safety and other type of aspects to that if they felt that was an issue.
Dr. Gerson, you said almost all cases in Manitoba are travel related. Can you give us any more clarity on that remaining, I guess, case 17?
Right. So I don't have anything more definitive to mention on that case. Again, it's there's a lot of aspects to that case that are not concerning to me to be community-based transmission. I would state at this point that it remains a presumptive positive case. And so we'll let the public know as soon as we have any information, but I'm not concerned about community-based transmission at this point.
So you said that the public health order issued yesterday doesn't yet apply to workplaces. Yet is the word that I'm interested in there. If you think that this might be something that's necessary at some point, why wait as opposed to doing it at the same time?
Well, all these decisions we make have huge implications, right? So we have 18 cases right now in Manitoba. We certainly expect that number to go up. We're not seeing evidence of community-based transmission, but we certainly expect to see that. All of these decisions have things we consider, right? So closing down the daycares, we now see that huge effects on the healthcare workers. We've been able to mediate that. Putting these immediate restrictions on workplaces could result in job loss, layoffs, and things. So all these things need to be considered. So right now, based on the dynamics we're seeing in Manitoba, this is what we feel is the best way to protect Manitobans. As we reassess, multiple times daily, if we need to restrict further, then we will.
And a follow-up to that is obviously part of the announcement from yesterday is the imposition of these fines if somebody is in contravention of these orders. And that one of those applies to corporations. If a fine applies to a corporation and they're still able to bring in these employees because there hasn't been a public health order issued to them, is it possible for there to be some sort of weird gray area where they have 100 people there but they don't get fined? Well,
the order does apply to some businesses. Okay. Right, they list certain, restaurants, bars, and things. So that's who would be subject to enforcement under the Act. But again, this isn't about orders. This isn't about fines. This is about Manitobans working together to limit the impact of this virus before we see widespread transmission.
One case in the last 2 days. Has Manitoba done enough to get ahead of this, or are you guys confident where you're sitting, or is it just kind of holding back what might be coming?
Yeah, well, we've been preparing for over a month at the highest level of preparedness. We can't look at the day-to-day numbers and make anything of that. So obviously, we like to see days with no cases, but seeing this, we can't make any judgment based on just having a couple days without a case.
We've kind of gotten to this rhythm of we get around 5 p.m. we get the new cases, but there was I guess on March 19th, there was a bit of a break from that, a delay in announcing it. Was there, why was there the delay? Was there an issue or something?
There wasn't an issue with the actual public health response. So we received those positive reports from the lab at our surveillance unit. Those are immediately sent out to the region of residents, who immediately starts investigating. So that person is immediately notified, isolated, and contact investigations. And that all took place with this case at that time. It was just a matter of when we had it to report in here.
We got some messages to our city desk basically from seniors who are concerned about this 30-day prescription order. Obviously, their 90-day prescriptions are what a lot of them are used to, and those cost a bit less. Is there some sort of middle ground that could be negotiated so that they can pay less and not have added stress during this time?
So when we make decisions like this, it's again, it's a rapidly evolving situation, and we make decisions based on what we think is going to be the best situation to reduce the impact of this virus. So as we saw fear and panic buying at various outlets and various commodities, we're concerned that a run like that on pharmacies could put substantial demand on essential medicines. So this is a decision made right now, and as we see things come in, then of course we can review the implications of it over time and look and see if we need to amend it. But right now it's in place to protect a vital supply of medications.
Can you just elaborate on that? Was that something that you were anticipating might happen, or was there actually people who were overfilling or getting more than they needed and maybe threatening the supply?
Yeah, I'm not sure if I certainly wasn't made of specific cases of it, but we did see it. You hear about it in other jurisdictions, and we see it with various other commodities. So we just wanted to ameliorate that before it happened.
Could I also ask for clarity under the public health order, just regarding transportation facilities? We had some calls, people who were wondering how that would work. Does it apply to the buses, for example, and how would it be enforced? Bus shelters, that kind of thing.
Yeah, so the order under there was specifically to facilities, so stations of the such. We know that based on the, again, from Manitobans following a lot of the social distancing recommendations, we're not really seeing a big issue with public transport right now. We're seeing a decline in that, and then we're going to review that over time, and certainly before we did anything specific in that regard, we would engage with our municipal counterparts.
So not buses?
Doesn't the social distancing recommendations apply everywhere, but the order does not yet.
There's still a lot of people going outside to get some fresh air, some exercise, taking the kids out. Are there concerns about that, especially depending what you've seen online? There's issues over playground equipment, that type of thing. How big of a concern is that as we move forward?
I think this is a tough time for a lot of people, right? And we recognize that, and I think that a lot of people are going to credible information to try to stop the spread of misinformation. People going out and being outdoors, I think, is good to stay active. There's certain implications. People who are self-isolating, certainly confirmed cases really need to be, for the most part, staying inside. And again, I mentioned yesterday it's very difficult to give general recommendations and then apply it to every possible scenario. Somebody asked about walking the dog. If you're self-isolating and walk your dog, is that okay? And for the most part, leaving your house, walking your dog around the block, staying 2 meters from everyone, you're outside, really, really low risk. But now apply it to somebody living in a 20-story apartment building needing to come down the elevator who should be self-isolating. Right? It's a different scenario. So it's really hard to apply everything to specific scenarios. So I would encourage people, get out to the park, stay active, stay healthy. There's more to our health than just avoiding this virus. But keep in mind those general social distancing strategies.
Can we get a status update on the people who have been confirmed their health and how they're doing?
With the exception of one person who is admitted to hospital in stable condition, everyone else is recovering at home.
You mentioned the number of cases that were being tested. I'm wondering if there's a breakdown between provincial and national labs, how many tests are being processed.
I don't have those specific numbers. It is available, the amount of testing done in each province. And and then how many of those get sent to the national lab, because many provinces are not needing to do that anymore. But for us, yesterday we ran about 300 tests. All were negative yesterday, and then I was informed that the overnight run was also negative. I don't know how many were run, but it was negative. And so again, that's the appreciation to CADM Lab working day and night getting these samples run for us.
Are the frontline workers hanging in there with everything going on? Are they? What's kind of the status out there?
Well, I think in my conversations, everyone's at different points. Some people are right into it now with the access centers and health links. Others are getting prepared in acute care and the personal care homes. So I would say everybody's working really hard and getting their processes in place and making sure that they do their part. So pretty.
Is there a burnout risk at some point during this for those frontline workers? During the past year with the Winnipeg Police Service, with the issues with crime they're having, that was a major concern, a major issue for them. Is there going to be a point where we're starting to look at burnout issues for frontline workers? Whether it's at the Health Sciences Center or at the labs, that type of thing.
Yeah, that's a really good point. And we certainly want to make sure that when we're ramping up services that we make sure we provide the adequate support to increase the volume. So like HealthLinks went from 300 calls to 2,000 calls. So making sure that they have help to get it done. It's not normal business for them. We will continue to monitor. We monitor sick time, we monitor overtime, and those are indicators of how we're doing. But it's also just the hearing from people who are working on the team, talking to people in the facilities and in the community, the healthcare workers, just doing what we can to support them. It's an issue though. This is a lot of work that they are being put under, and we're very proud of the work that they're doing, and we want to make sure we support.
Dr. Rusin, one question I have relates, I guess, to tenants and people who might be in, I guess, untenable situations regarding their rent due to loss of employment. Have you discussed with the provincial government at all maybe implementing some sort of eviction freeze or rent freeze in order to protect people, make sure that they're actually able to stay at home rather than being told, get out and find a new place to stay?
So there's a all of government approach to this right now. So we'll have to direct that to the proper branch. But there is all of government planning on many different scenarios like this. I mean, we realize that this is challenging times for Manitobans, but at the same time we're seeing Manitobans rise up to that challenge, right? So so for sure we're looking at all these type of issues.
Yeah, I meant more from a public health concern, because when people are being told to stay at home, and then because they can't pay their rent as a consequence of what's going on, they're going out or having to find a new place and moving. Like, that's got to be.
Yeah, and like I say, is that all the decisions that we make regarding this are not made lightly. We know that this virus it poses a significant issue to Manitobans. It's caused significant harm in other jurisdictions across the world, so we're preparing for it. But we realize that health is bigger than just this virus, and certainly bigger than just healthcare. And so all of these decisions that we make, we consider all these implications.
Anything else? All right, thanks, Anna.
Thank you.